This is part 2 of my conversation with my guest and expert witness, Anne Longfield, CBE, Chair of the Commission on Young Lives and the former Children's Commissioner for England. We talked together about Principle 8, trust is the glue of life. It was brilliant talking with Anne because I've admired Anne for so many years before I knew her. I've watched her work in her role as Children's Commissioner for England, and before that, as she worked alongside the Labour government years ago to introduce the idea of Sure Start and children's centres, working with young parents and young children, creating for them a better future. Anne is an entrepreneur and a brilliant thinker and strategist. You'll enjoy what she has to say. You've just been listening to me talking about Principle 8 from my book, Trust is the Glue of Life. And now with me is my guest and expert witness, Anne Longfield. Anne, as you've listened to me, what thoughts does it bring to your mind?
Well, there was obviously a lot in there. And again, so much of it was very, very familiar in terms of the experiences that, communities have, what children tell me, young people tell me, and indeed what their families say to me. At the centre of it is about what we invest in our public services. We all pay, it's taxpayers' money. And we choose things that are supposedly priorities, and then the public purse pays for them. But by doing that, often for politicians, for those that are, responsible for administering them, sometimes it can be really tempting for the job to be done. You've argued for it, you passed it, it's there, it's done. And of course, you will know that is just the start. That's where the hard work starts. So there is this kind of tendency, and obviously everything circulates around a very short political kind of timescale as well within that. But at the heart of it is, what are we paying for? What do we want to achieve? And for me, there's not enough time taken when those programs are rolled out or agreed, thinking about what do we want to change by this, or what do we want this program to deliver, and how will we know when we've got there? And then the other part of it is that there aren't enough things that join up properly. So you just get this scattergun of money, which is all disjointed and isn't thought through. So for instance, when about 3 or 4 years ago, there was a particular spate of violence across London, lots of departments in government said that they want to do something good. We all want people to notice and respond. So when this spate of violence erupted across government, it was a time where I was Children's Commissioner. And lots of departments wanted to respond. But we also counted how many different pots of money there were suddenly across government. There were 11 different pots of money, all separate, all small scale, all acting in isolation, all really happening partly to do their bit, but no one coordinating all of those or clear what the outcome will be. Put all those pieces of money together and do it properly with local groups and communities. Fantastic. Leave it as 11 short-term pieces of funding that just happen, or do they happen? I don't know. No one could really tell me when I asked. And you've got a wasted opportunity. And what services are for, what support is at the heart, I think, of what is missing as a starter. The other part, of course, is about services that are in the culture, and it is exacerbated by a shortage of money. It's exacerbated by, restricted budgets, exacerbated by higher and higher thresholds where, the culture, whether people like it or not, is doing stuff to people rather than with them.
So why do you think that happens? Why do you think that when it seems common sense that to spend money on people without asking them, A, what they really need, and 2, if they'll be involved, which is empowering, why do you think we fall for this same thing time and time again?
It's how it's done. So it's really difficult to change what's already happening. And whether it's, a central government or a local agency, it's the way it's done. Often funding's made for a short-term period. Sometimes it will come out late, so you've only got a little while to spend it. It's achingly practical. Of course, it shouldn't be like this, but you can see how it happens. Money comes out, needs to be spent. People want to do something. There's not the time to do the long-term planning, engagement, needs to be banked. Off it goes. And the amount of money which is spent in that way, which again is money in the public purse, there's a very negative cycle, not only because money is being spent and not delivering what it could be, but again, that issue of trust. People in communities don't have trust in it, but also those that we want to spend real money don't have trust with it because they say, oh, we did that and nothing happened. Or, I paid for 500 youth workers. I can't remember anyone ever telling me what happened, so we won't do that again. So it's really important to change completely, in my view, every aspect of how we look to support vulnerable communities, well, all communities, but vulnerable communities, and think about it properly, as you say, intelligently, commonsensically, and really have that long-term investment that means you can really grow that capacity. There's one thing I think I just want to say to you, I think you're doing yourself down a bit by saying that there's only one community where, they know and trust you. Because actually, when you go into different communities where Oasis are there, Oasis is doing the work for you, if you like. You go in with that trust because they know what Oasis stands for. They know that when you go there, you are always talking on behalf of communities. Most of all, people say they want someone who's on their side. Anyone who spends more than about a sentence talking to you will know that you are on their side. And that's the trust element in it.
Well, there you go.
It's not just, I've never worked in the community I live, but I hope that people can have trust that I not only mean what I say, I know what I'm talking about, but also I deliver on it, because that's the other part of trust. People, and I used to say to kids often as children's commissioner, what do you want of your commissioner, And they'd say, well, we want someone who we know is on our side. We want someone who's got the status and the kind of credibility to be able to go into those places that we can't go into and talk to decision makers on our behalf. But also, we want people who are going to deliver. So when I first became children's commissioner, lots of children who are living in care came to see me. And I'd say to them, what would you change most about living in care? And one of the things they always said is, we get fed up. We've been moved from pillar to post to pillar to post. We want people to understand that actually that's not the right way to do it. We want people to understand we need to be in one place and have relationships and grow. Now, I understood what they meant. They knew that I could empathize with that. They trusted that I was responding to that. However, it was only when I said that I would deliver on that they really could see that things were changing. By delivering it, I set up a whole research program that monitored and counted every time a child was moved in the whole country that was in care. We did that. We sent that to local authorities so that they could see. We turned the approach to that. So we actually pointed out when it was happening. And before that, people used to say, well, of course, we try not to move children, of course. But actually, through our work, we pointed out they were. And stability started to become the thing that people measure. And people started to notice when it wasn't happening, which in turn meant that children were having a much more stable time in care.
Two things to say, Anne. First of all, it's encouraging to hear you say that, perhaps when I go to other communities, they don't think, well, who's this bloke who's just strode in?
Well, they might still think that.
Yeah.
Come on.
And I get that a bit. I do get that a bit. And I think I'm so aware of the fact that you need to belong and you need to be known.
Yeah, we can still be useful if you don't do that. And people just want people to be useful. That's part of it, I think. Not everyone is going to be able to be the person they relate to every day. But if you can function usefully and actually, help life, practical help is just so important.
And some of that's about longevity, isn't it? Even perhaps if you don't live in the community. Well, and of course, Oasis staff across the country, the vast majority of them don't live in the communities where they work, and they can't. It's just that I feel that wherever we work, we try to make that link where at least some of the people
Sure.
are there all the time. So they're listening
Sure.
and they're feeling the thing.
Sure.
So they're not people who come and hear about the lack of resource in that community. They're people who experience it every day of their lives, because they are the community. So, no, but that's a really helpful thing you've said.
But I think, I mean, the other thing is that I don't want us to give up on publicly funded programs, because to get to the scale we need to respond to the challenge of what we know the need is, we're going to need large scale funded programs. Now, if it was down to us sitting here today and working out what that might be, we'd have to address the fact that we couldn't work in every community for 5 years to work out what that would be. Things would get worse. We wouldn't get the money from Treasury. Another political cycle would have gone. Children would have grown up, all those things. So I think that there is a way that we can change the way that publicly funded programs work. So you almost build an infrastructure through publicly funded money, and then the infrastructure values and works in the way that you're describing. So I was very involved in advocating for Sure Start. I spent some time in the Prime Minister's Strategy Unit when Tony Blair was Prime Minister, looking at how that could be developed. I ran Sure Starts at my charity for children at the time. And they were a big, large-scale, multi-billion funded program. But essentially, the programs that you're running in local communities were doing the jobs of Sure Start. They just had, a lot of money behind them, or some money behind them, to make sure that it happened. It was almost like, we have schools, we have hospitals, and we have children's centres, Sure Starts, infrastructure. The people who worked in there had to be able to build those relationships, had to be able to work with local community members, had to run the whole centre on the basis of working with community members to shape what that was. But nonetheless, the long-term assurance that funding was going to be there, which in fact didn't come good, because of course the Sure Starts were massively depleted in numbers over the years. But that doesn't mean we should give up on it, because actually it needed to have bigger roots. It needed to have bigger roots, and it needed to have cross-party support. And with that, it might have found its way through. It's too easy to kind of chop out, if you like. But for me, that's the way we get all of what's so precious about what you're describing in terms of trust and bonds in the community, and that, deep understanding of community, what the community needs, and also that trust. I think there's something there that you can capture, and you can put it within a framework that has an infrastructure that those that are giving money out nationally, centrally, can feel a bit more comfortable with, because we know that central government is massively risk averse, never has enough time, never has the capacity to be able to work out what communities want, or in fact, how to deliver it. But nonetheless, access to large scale funds on occasions, or larger scale than, most small charities are used to really have powerful interventions that can bring about change. So my ideal is to bring the both together, the infrastructure, but then you populate the infrastructure with everything you're saying that comes from working with communities, and indeed run by community groups, just as I did with Sure Start.
And I think what you're saying is really very important, foundational, isn't it? In actual fact, although we're talking about Principle 8 in my book, the very introduction to my book is about exactly that. Basically is saying that there's a limited public purse. It's not a money fountain, is it? A money tree. There's a limited amount of money, a finite resource that we have to spend. And it's about how we spend it that makes the difference. In fact, I say in my introduction that when William Beveridge first dreamt of the welfare state and wrote about it in what became the Beveridge Report, and he saw the welfare state and its crowning glory, the National Health Service, came into operation in 1948. In 1946, 2 years before it was all in place, he wrote a second report that nobody ever talks about. And the second report said it will fail. It said there's a fatal flaw because what you've done is you've taken what I wrote of as a partnership between statutory services. He didn't call it that. He called it the civil servants. He said, you've taken what I saw as a partnership of government and local people, voluntary services. You've taken that and you've written out the local people because you don't trust them, because you find them awkward to deal with. And he prophesied that it wouldn't work. It wouldn't work, he said, because you've abandoned the central tenant. And that's what happens when we use public money without talking to a local community.
But my argument being that it doesn't have to.
Of course not, but it's what we did.
Sure, but you can reshape the way that funding is delivered and
How
that
will
we
we do
prioritise that for communities. That means that the trust element, the community element is baked in. That's how you do it. People are taught that way. That's the way that funding requires it to be done. So for
the question
instance,
is, absolutely. So why haven't we done it?
Well,
and how do we get to do it?
Because I think, over the years, that's not how programs have run. People feel less comfortable in that way. There's a lack of knowledge often at the centre of how you do it. It usually requires working with other people, which gets messier for government, and they're massively risk averse. I mean, you can imagine the alarm bells are ringing all the time. But it comes back to, do we want the money? And by the way, I know you say there is a limited amount, but I suppose that's not my point. My point is that as a country, we've got, or, as a country, as a government, we've got substantial resources which we can, if we choose, put into certain things to bring about different outcomes. Look at what happened under the furlough scheme overnight during the pandemic. Huge amounts of money, which lots of people clearly benefited from. But the long-term view and lack of vision, if you like, and lack of clarity of what we're trying to achieve here is the thing which I think just, puts it all into jeopardy. For instance, going back to Sure Start, the aim there was to provide place-based, trusted relationships, trusted people, places people could see as part of their community, where over time they could get the help they needed as their children grew up. All parents need help, but sometime it was there. It didn't have to be delivered by, a traditional statutory approach, if you like. So for instance, as a charity, we ran a children's centre in Essex. It was operating in a repurposed primary school. It's a big affair. But actually, alongside the services which were run, health visitors came in and did their stuff, other people came in. Alongside that, there was help and support for local people to provide their own groups. There were 40 other groups going on, support for dads, support for families with twins, support for lots and lots of different things, and help there for those families to get the groups off the ground, which they ran themselves. So just as Oasis provides an infrastructure in an area, which is obviously so vitally important, the trust comes with that, I think it's possible for public services to be designed in a way which not only allow, enable that to happen as a core part of what they do. Because I think, we're on the subject of trust here. Trust is like the code that's going to be absolutely essential for whatever we do to be effective and for whatever results we want to see coming in. So I don't think any service can say that it can truly be sure it's going to deliver if it doesn't have that trust, which is why we need such, in my view, wide-scale reform and change of the way that those publicly funded services are run. And, from everything that you're doing, that's the other part of this is how you've got the code, but you need to be able to dock into an infrastructure that means that every area can have this kind of support, not by, someone who comes along in a suit, but by their own community that has not only the backing of those resources, but also the remit and the mandate to be able to work with communities to build their own capacity. That's kind of my dream, if you like, is to be able to kind of rocket boost, I guess, what you're doing so everyone can benefit from that. One thing that my team and myself always say when we come out of an Oasis place is, which usually we've been blown away by stuff that's happening there and the relationships and what could be possible. Because I think that's another part of this. I'm sure that's another chapter, but what you're doing isn't kind of timelined. Lots of things are possible because you make them happen. We come out and we say, isn't that fantastic? It just shows what you could do. Shame there's not one of those everywhere. Yes. And that really is what I think we've got the potential to do, to be able to reform and recalibrate the way we make decisions about public money.
Mm-hmm. And what I feel about what we do everywhere, I am proud of what we do everywhere and the extraordinary staff that do it. But, that bit more that we could do, that extra mile that we could go, those new initiatives that would empower more people, enfranchise more people, what that needs is that public fund spent well and invested well. Because often the frustration is that you're sitting there and you know the people and you know the needs and you live their pain and you feel their pain and you watch fund after fund go past, and the funds are often given away. I mean, this is a harsh way of saying it, but by people who've never lived in the community, probably never been on a council house in an estate anywhere and had a meal with anyone, probably don't have one friend who's lived on benefits or struggled with disability and living in a cramped conditions. But from a distance, policies are made that somehow bypass all these people and spend the money on all the wrong things, whilst those of us on the front line are left struggling on.
But wouldn't it be fantastic if that was turned on its head? So actually, it just wasn't an endless battle to try and get some help or some money and, that constant kind of revolving door. Wouldn't it be fantastic if, part of the remit of, a community entity, if you like, that was funded was to, over time, build capacity, build housing. That was not only a vision, it was actually a program. And someone was kind of ringing up saying, oh, that's great, you've done that, now can you do this? And now, so it was actually, everyone was running along the same pace that you so often are. Wouldn't that be something that would make all our communities just much, both richer, more stable, give that greater depth of texture, so we could all feel that our communities were, really reaching their potential? I mean, that could be possible. It doesn't have to be. No. It doesn't have to be around happen chance or a community being particularly well organised or all of those things. It could be what essentially we all decide as a country. We want communities to have that level of backup. Which is where we need to get to. So what I'd like to ask you about, Anne, is you've talked about Sure Start centres. And they were brilliant, weren't they? So, Well, I thought so. Yeah, they were. And so working with children, but working with their parents. Yeah. And creating hope for parents and belonging for parents and community for parents. And trusted relationships. Trusted relationships. So everyone thrives together. Yeah. But then they were stopped. Why did that happen? Well, they were stopped. I believe that was a historic mistake. And I think that was a game of kind of political tit for tat because they were seen very much as a new Labour initiative. It was a bold move to roll out 3,500 of them with a big programme over a very short period of time. And there wasn't cross-party support as such, and the roots weren't deep enough. So when we had the period of austerity begun, then a lot of local authority areas felt they just couldn't afford to keep them over. Their central ring-fence budgets had all gone. So that's why this can't be something which is, just, the flavour of the month for one political party. It has to be, as a country, how we choose to change things. And something like this, in my opinion, and I know you say this in your book, needs a 20-year plan. We need a wholesale reset of that, the way we create an infrastructure in our local communities. Now, the good news is that we know it's possible, and there are still, in some areas, children's centres that are running. I mean, Leeds, for instance, they've been the springboard for huge amounts of success around reducing obesity, around family support and the like. But that isn't consistent around the country. And, whether you call it a Sure Start or not, I don't much care. Government at the moment likes the idea of family hubs. What is important is that kind of infrastructure is in place to be able to work with communities. And I think with that, alongside everything you're saying at the heart of that, imagine what we could achieve.
I often think, Anne, that with the disappearance of so many of the Sure Start centres, which work with parents and, their young toddlers and under school age kids, they disappear. And then 10 years later, when those 3-year-olds are now 13-year-olds, 14-year-olds, 15-year-olds, as, time goes on, you see the huge issue we've got around grooming and gangs and violence now. And I often wondered to myself whether these two things were linked. That disappearance of the support for parents ends a decade or more later with a whole load of social issues that perhaps wouldn't have happened if that investment had carried on.
Because, of course, the two things about something like Sure Start, first of all, because those services, those people were known to communities, they could work out when things were going wrong earlier and respond earlier, so it didn't get to crisis point. And because they could work over time with those families as well. Wherever I go and I talk to head teachers and I talk to people in the police and I talk to people in housing, wherever I go, at some point in the conversation, someone says, if only we'd have had Sure Start, we wouldn't have had this happen because someone had noticed earlier and that would have been there for parents. And at the heart of that is that you've got a community entity which people know is going to be there, know it's for them, and there's people there they know are on their side and that they can trust. And that's why, as you say, trust is the glue of life.